The challenge arisen from the use of drugs is most acute in the United States. 12% of global drug users come from the country, 3 times the proportion of the US population to that of the world. American death toll of drug overdose has increased exponentially over the past 38 years, doubling about every 8 years. In the year following the outbreak of the pandemic, more than 100,000 people in the United States died from drug overdose, nearly tripling the number of deaths in traffic accidents. During the past 12 months, 48.2 million Americans over the age of 18 consumed cannabis at least once. Though outlawed by the federal authorities, cannabis is legal in 15 states for recreational use. Behind such astonishing figures is a long-standing social problem. Moreover, the figures shed light on the US government's superficial anti-drug efforts. By the 1960s, nationwide hippie culture pushed for the social acceptance of cannabis abuse on the grounds of human rights and liberty, bringing such harm to society. But even so, the argument for legalizing drugs never went away in the US and even intensified. In 2014, cannabis was legalized in Colorado, bringing the number of deaths from various kinds of drug abuse in the state has reached record highs, further boosted the black market, which in turn puts great pressure on the judicial system and threatens social security. Interest groups in America keep fanning the flame of the drug problem, promoting drug sales and doctors into indiscriminate prescription of drugs, and lobbying the Senate and the House of Representatives to consider bills that promote the legalization of marijuana and cannabis actively. After analyzing disclosed data from the US Senate, the marijuana and cannabis industry, which involved more than 20 businesses, spent as much as $4.28 million on lobbying in 2021 alone. According to Howard Koh, former Assistant Secretary for Health for the U.S. Department of Health and Human Service, drug and substance abuse in the United States is one of the most devastating public health disasters. Apart from causing heavy burdens on the public health system, it could make millions of people lose their homes or jobs, become truant, or face family breakdown. The drug problem of America is a long-standing and deep-rooted disease that is yet to be cured. The US government has not done enough to raise public awareness of the harm of narcotic drugs, and its drug control actions produce poor results. The United States should stop making unwarranted accusations against China and undermining China-US counter-narcotics cooperation. Even less should it mislead the public and shift its responsibility for ineffective response to drug abuse at home onto others. Before blaming other countries, the United States should review itself first.